Do you wake up with back pain that just won't go away? Is it just normal wear and tear or something more serious like ankylosing spondylitis? Knowing the difference is critical, and today I'll break it down for you in a way that's easy to understand. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, I'm going to help you understand the key difference between ankylosing spondylitis and mechanical back pain, because getting the right diagnosis is the first step toward the right treatment. Back pain is incredibly common. About 75% of people will deal with it at some point in their lives. But not all back pain is the same. Mechanical back pain is the most common type. It happens because of strains, injuries, or aging. Ankylosing spondylitis, or AS, is different. It's an autoimmune condition that causes chronic inflammation in the spine and can lead to long-term stiffness and even spinal fusion. The biggest problem? Many people mistake AS for regular back pain and delay treatment, which can lead to serious complications. So how do you tell the difference between these two different types of back pains? Number one, what is ankylosing spondylitis? Ankylosing spondylitis is an autoimmune disease where the immune system mistakenly attacks the spine and sacroiliac joints, where the spine connects to the pelvis. It usually starts in young adults, late teens to 40s, and is a bit more common in men. Over time, inflammation can cause bones in the spine to fuse, making movement more difficult. The key feature of AS is inflammation, not just mechanical wear and tear. What is mechanical back pain? This is the most common type of back pain, usually caused by poor posture, muscle strains, herniated discs, or spinal arthritis. It happens because of injuries, aging, or stress on the spine, not because of an autoimmune condition. How do you know which one you have? One of the biggest clues is when your pain is at its worst. If your pain gets worse with rest and feels better with movement, it could be ankylosing spondylitis. If your pain gets worse with activity and feels better with rest, it's probably mechanical back pain. Morning stiffness is another sign. If you wake up stiff for more than an hour, that's a red flag for AS. If the stiffness lasts just a few minutes, it's more likely mechanical pain. What about nighttime pain? AS often wakes people up in the early morning with pain. Mechanical pain doesn't usually wake you up unless you've recently had an injury or overworked your back. Age can also matter here. AS usually starts between 20 and 40 years old. Mechanical back pain can happen at any age, but it's more common as people get older. And genetics can also be a factor here. If you have a family history of AS or test positive for the HLA-B27 test, you may be at risk for AS. Mechanical back pain has no known clear genetic link. It's mainly due to instability, lifestyle, injuries, and aging. So how can your doctor diagnose ankylosing spondylitis? If you suspect AS, your doctor will run a few key tests. They should certainly start with a good medical history and physical exam. We look at how your symptoms behave over time. Next, we may do some blood tests. Some people with AS have an elevated inflammatory markers like CRP and sedimentation rate, and may test positive for the HLA-B27 gene. Imaging can also be key here. X-rays or MRIs can show inflammation or fusion in the sacroiliac joints. For mechanical back pain, imaging may show disc degeneration, spinal arthritis, pinched nerves. If you have AS, early diagnosis is crucial because untreated inflammation can lead to permanent spinal damage. So when should you see a doctor? If your back pain has lasted more than 3 months and doesn't improve with rest, get checked out. If you wake up in pain at night or have morning stiffness that lasts for over an hour chronically, don't ignore it. If you have a family history of AS and back pain, it's worthwhile getting tested as well. And if your pain started suddenly after lifting something heavy, it's more likely mechanical, but still worthwhile seeing a doctor if it doesn't improve on its own with time. The treatment options for each condition vary a bit. Reality is that there are some commonalities when it comes to exercise, but when it comes to really the core treatment of ankylosing spondylitis versus mechanical back pain, there are some differences. For ankylosing spondylitis, exercise is key. Regular movement helps keep the spine flexible and prevent stiffness. Physical therapy for stretching and posture exercises can help reduce pain and maintain mobility. Anti-inflammatory medications like NSAIDs, such as ibuprofen and naproxen, can help and control symptoms. Biologic medications, this is the big difference. In more severe cases, biologic medications that control the immune system can reduce inflammation and prevent disease progression. For mechanical back pain, strength training is key. Strengthening the core and back muscles helps us support the spine. Improving stability is key in mechanical back pain. Posture correction. Using an ergonomic chair and avoiding slouching can make a big difference. Physical therapy to help with strengthening and stretching, and manual therapy can be very helpful. Heat and ice can be helpful here. Applying heat can relax tight muscles, while ice can reduce swelling. Chiropractic care or massage can be useful here. Hands-on treatments can help relieve tension and improve movement. The big difference here is that for mechanical back pain, regenerative medicine treatments such as prolotherapy and PRP can be very helpful in mechanical back pain. So the key differences are, while there's some commonalities in treatment, for ankylosing spondylitis, if it's bad enough, we're using more aggressive medications that work on the immune system, while in mechanical or degenerative back pain, we're utilizing regenerative medicine treatments to help with stability. Ankylosing spondylitis is an autoimmune disease, while mechanical back pain is caused by injuries or wear and tear. If your pain is worse with rest and better with movement, it might be inflammatory. If you wake up stiff for over an hour or have nighttime pain, see a specialist. Getting the right diagnosis is crucial because the treatments are different, and it makes a big difference long-term in terms of your outcome as well. If you found this video helpful, make sure to like, subscribe, and hit the notification bell for more expert advice on musculoskeletal and metabolic health. If you're struggling with back pain and need a precise diagnosis and personalized treatment plan, visit us at chicagoarthritis.com to book a consultation. And until next time, live well. Bye-bye.